Good morning. My name is Dr. Jeremy McAnulty and welcome to New South Wales Health's live stream briefing for COVID-19. There were 1,007 locally acquired cases of COVID reported in New South Wales for the 24 hours to 8 o'clock last night. There were 108,105 COVID tests reported to 8 o'clock last night. And across New South Wales, we now have 84.7% of the over 16 population who've received their first dose of COVID vaccine and 57.8% who are fully vaccinated. The total number of vaccines administered in New South Wales is now 9.4 million doses. So this is fantastic. The number of people who've come forward for testing, we'd really like to thank you as a community for coming forward to protect us all from COVID by getting vaccinated. In terms of hospitalisations, there are now currently 1,187 patients with COVID in hospital, including 229 who are in intensive care, of whom 118 require ventilation. Sadly, we're reporting 11 people who've died with COVID in the last 24 hours, including 10 men and 1 woman. One person who died was in their 40s, one person in their 50s, 2 in their 60s, 3 in their 70s, 3 in their 80s, and 1 person was in their 90s. 2 people who died were from southeastern Sydney, 5 were from southwestern Sydney, 2 were from Sydney, 1 was from Blue Mountains, and 1 was from Western Sydney. One of these cases was a man in his 70s from the Blue Mountains who acquired his infection at the United Springwood Residential Aged Care Facility where he was a resident. He was not vaccinated. 9 people were not vaccinated and 2 who had received 1 dose. At least 8 people had underlying medical conditions. 3 people, 1 man in his 40s, 1 man in his 50s and 1 woman in her 80s died at home. Their infections were diagnosed after their deaths. We'd like to extend our deepest sympathies and condolences to the family, friends and loved ones of these people who have died. There have been 288 COVID deaths in New South Wales since the 16th of June 2021 and 344 since the start of the pandemic. Sadly, we've seen a number of people who've died with COVID and been at home and diagnosed after they've died. And so I guess it's an important message that we'd like to get out, is that if you have the mildest of symptoms, come forward for testing for COVID, and if your condition deteriorates, call your doctor sooner rather than later, get medical help, and in an emergency, call 000. There have been a number of sewage detections as part of our ongoing sewage surveillance system that's detected fragments of the virus that causes COVID in a number of communities. This has been Tamworth in the northwest of the state, Derriton and Balranald in the far west, Oberon in the central west, Dungog in the Hunter, and Eden on the south coast. So anyone living in these communities, please watch out for symptoms and come forward for testing with even the mildest of symptoms right away. If there are cases in these communities, it's important we identify them and so we can protect others in the community as soon as possible. The suburbs with the highest number of cases in New South Wales in the last 24 hours have been largely in the southwest and western part of Sydney, but also we've seen increasing cases in the Illawarra. So Liverpool, Yagoona, Guildford, Greenacre, Merrylands, Warrawong, Auburn and Rooty Hill. No matter where you live in New South Wales, if you get symptoms, please come forward for testing. There are many clinics available in all communities, so please come forward sooner rather than later on the day you get symptoms. I want to give a breakdown in the regional areas of the state of cases over in the last 24 hours up until 8 o'clock last night. In the Illawarra Shellhaven, there were 70 new cases reported. In Western New South Wales, across the district, there were 20 new cases reported. In the far west, 6 new cases, all in Broken Hill. In southern New South Wales, 4 new cases were reported in Goulburn. In the heart of New England, 31 new cases were reported. On the Central Coast, 31 cases were reported. In the Murrumbidgee, there have been 3 new cases reported. And on the Mid-North Coast, 1 new case. We're concerned that in the last 24 hours there's been an increased number of cases reported in Lithgow. So people in Lithgow, please watch out for symptoms and come forward for testing with even the mildest of symptoms. It's important we, again, make sure that we're finding any cases in Lithgow and surrounding communities. So I'd just like to say vaccination rates are increasing. It's really proud how well the community is coming forward for getting vaccinated, and the more people we can get vaccinated, the sooner we'll reach those goals of 70 and 80%. We want everybody to come forward and get vaccinated. So if you haven't yet come and had your first dose, or if your family and friends haven't yet, please remind them of the importance of getting vaccinated. There are many clinics. You can go to your GP, pharmacy, and many of the state-run clinics. So please don't hesitate. Come forward for getting tested if you're eligible. Thanks so much.